And this time we're going to kick it off with Mr. Bill Martis, the president of Strategic Security Management Consulting, someone that I have known for probably 6 years. Because he gave me my first challenge coin in 2019. So I know exactly 6 years. But more importantly, why he's here is because he has 40 years of healthcare experience in various seats, various ways, shapes, and forms. So truly an SME in healthcare physical security, been there and done that. He has been state to state, at least, holding some of those seats and doing some speaking engagements. So welcome, Bill. Thank you very much for joining us in this third of the series.
Well, thank you for having me over. Okay.
And what we're going to dig into this time, and quick recap, super quick recap, because it's very informal. These are going to be security directors, just like you were, that are going to join us, Bill. But we had Loris kick us off as to overarching what it means to have physical identity and access management in healthcare. We had Paul dive us in specifically when it comes to auditing and compliance. Now we're going to specifically have you, Bill, take us down the hallway and understand more about how automation can reduce access risks in healthcare. Again, that's your bread and butter for 40 years. So we want to hear more about that. I want to kick it right off and tie this into workplace violence. Something we hear in workplace violence all the time is, I just thought this was part of the job. And when we were rehearsing for this topic with you, that really stood out to me. You said the pain of the manual stuff you had done over the decades, you really just felt like it was part of the job. And obviously we're in a different place now. Please elaborate on that.
Well, workplace violence has really changed. The landscape has changed, particularly in healthcare, leading the way. One of the things that I've kind of said in a couple different venues now is I didn't really realize how far ahead healthcare was in terms of workplace violence prevention and response until I stepped outside of healthcare and began working on projects that were not involving hospitals or clinics. And it became evident to me after doing two or three of these when these folks were asking for solutions for workplace violence prevention and response, that all I was doing was just going back in my mind and picking out the best practices and things that we have done collectively in the healthcare environment and made these suggestions and applied them in other types of industry. Although it does rear its ugly head in a few different other places, and maybe some organizations where the culture is not as refined as it is in most others right now.
Okay, so your feeling for workplace violence in general is that you came to understand healthcare actually might have been a little bit ahead. But when it comes to um, the manual processes of dealing with the physical identity and its access, and entering in these contingent workers and having a whole different process for how you enter it in when they pick up another hospital, what you were saying before was like you just kind of thought that that was what had to be done. And like you were saying, I had some notes. You were saying like toward the end of your career, you came to see that, oh, wait a minute, there's some systems in place that can automate this process. I don't have to manually look at a spreadsheet and have my team terminate this guy or gal. Like, I've been doing this for years in this way.
Yeah. We have had to build in some kind of processes internally, whether it's been organizations I've worked with or have consulted with. So I think the most common stopgap for making sure that people who had previously gotten access to your facility don't get it after they've been terminated or
Mhm,
have left the organization, and sometimes there's a breakdown in getting that communication to
mhm.
whoever is managing the access, is really just to turn off access after 90 days of non-use of that badge or 60 days. That's pretty much I would say it's probably almost a standard where that happens with most organizations. However, I would have wished that we could had some of the automation functions that we were discussing earlier kind of
Mhm.
built in, where you check on people automatically or you ping them instead of waiting 90 days for somebody to indicate that badge has been deleted, you can send out a message to that person or maybe to HR. Hey, is Joe Jones still here?
Hmm.
If I don't hear back from you in 30 days, I'm going to turn access off. Or you can kind of make a self check, or maybe the process gets automated in such a way is that as soon as somebody in HR does a termination, they just do a few keystrokes, and that person is somehow automatically taken out of the access or has their access suspended
Yeah.
until somebody comes back in and says, okay, this person is not terminated. Let's let them continue.
Yeah, I mean, that's literally where we are. That situation you just described, where HR does their thing and whatever their system is, now to your point, it wasn't always there throughout your career, but to your point, now that's where we are. We are at a place where if HR says they shouldn't be here, all the downstream systems should be able to pull them out with some degree of automation. Um, and so from your experience, and I'll share that I hear this often that there is a high degree of manual entry when it comes to this stuff. So what I hear is we're managing this big generic inbox and we're just looking for Cleat and Bill to come across as names to give more access to or names to terminate, or Cleat, we got a spreadsheet every Monday and this is who we have to deactivate, et cetera, et cetera. Those, managing a mailbox, spreadsheet, how often are you still seeing that, we should say?
More often than not, I
Ah,
think there's a lot of organizations
yeah,
out there that could use some
that's
form
what I
of
hear.
automation. Garden variety. This is, and I don't want to call anybody out because,
Right.
resources are what they are. And we have to
Mhm.
work with what we have. When the employee comes down that's new, or a manager comes down new with a requisition sheet, and then you throw it on the pile, and then you're a large organization and you have 30, 40,000 employees. You have to have a process in place that deals with that. And what I've seen in some situations where you have maybe one or two access control people that are making 500 edits a week,
Yes.
that's pretty onerous.
Yeah.
The world is changing too, with threats and being able to address threats. And one thing that I've seen were situations where an employee may be out on leave of absence or something like that, and something happens, and then they come back to the hospital and cause a disturbance or something like that.
Hmm.
And the question becomes to you, the security director, why did this employee have access at all? They've been out for 6, 7 weeks on leave. Is that really safe? But then when you try to take that example and place it into your current process,
Hmm.
even the IAHSS standard on ID management and access management credentialing doesn't say you have to have an automated process for that. So
Yeah.
it's
That's a good
you know,
point. That's a good point.
but but
There's
what I
you talked about an inbox with hundreds. I knew a facility in Ohio, and they had 400 on average. They had 400 a day. So to your point, there's hundreds of emails that are just sitting in a box, and they had one FTE that just came in every day and just went through the email box, trying to get as much done as she could. And she comes in the next day, so 400 waiting on her every day. She gets in there, and she has to try to stumble through there.
Yeah, well, let's not let her take a day off, because
Exactly. Exactly.
hope you
Or
have
the weekends.
redundancy for
Yeah,
that.
yeah.
400 a day.
My colleague
Yeah,
Kyle Ellie, he has a saying, "Software never sleeps." And you realize the importance of it when you understand that in some cases this means active badges with Gamma Lab access, and then a whole host of other things that are happening that we learned from Paul. All these different labs and things like that. There's some pretty nasty things in hospitals that you want an immediate termination of access, but you can't get it on the weekend when you're managing it by an email inbox.
true, true. And a lot of security departments don't allow maybe the crew that's on the weekend, they're not the ones that are trained in the software or the applications such that they can make that change. But I've also seen other organizations that drill down right down to the security operations center dispatchers who have access and are able to make those changes, on a dime. But
Mhm.
you have to be aware that that needs to take place in order to get that done.
Um,
Automation could help
mhm.
if the supervisor of that employee who's being terminated could just go into, whatever software you're using, say this employee is being terminated, da 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 da, click, 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 and that automates the process, and that employee's access gets turned
Mhm.
off. And we could check that later on.
Yep. That's exactly where we are at with technology right now. To your point again, I'll just keep going back to what you said because it really stuck with me is you just thought this is what the process was in healthcare. And for many years that's what it had to be. But it doesn't have to be like that anymore. Something else you told me about, and I don't know where it was. I think I remember it was you were talking PEDS units, but these are some nurses that you were talking to or dealing with. Tell us a little bit more about that. Like, why would they want to lock their unit better? Why can't they lock their unit?
Yeah, it's I've dealt with this both as a security director and as a security consultant where, excuse me, we'll get some input from
Mhm.
a clinician, on a nurse on a floor, or a nurse manager, and they're demanding that their unit be locked down. And of course, you go
Mhm.
in there, you're the physical security guy. You go there, you spec it out. Oh my God, we're going to have to redo this door here. It's going to cost $20,000, and then add access to it. And the next thing you know, you get that set up, but when they ring the buzzer outside the door, the nurse now has to get up, or the unit secretary or
Mhm.
whoever. Somebody has to go to the door and check that person out, or get them on the intercom and find out who it is and buzz them in. And what if that person's not sitting at the desk there to look at the camera?
Mhm.
That gets old after a while. And the next thing you know, you come back and there's that, you know, piece of wood that somebody's gotten from their backyard, and they've come in and they've wedged under the door because they're tired of getting up and answering the
Opening the
door.
door. Yeah.
And there goes your $20,000 investment in your physical security, defeated, because the culture was not willing to accept that security measure, nor are you finding it. Well, maybe we really didn't need that, coming out of the nursing staff, because convenience
Mhm.
trumps,
Security in a lot of times.
security.
Yeah.
So, but maybe there is a real reason for that, and people just are complacent too. So that's another reason why automation would work. I like the opportunity to maybe do that, and then a lot of nurses carry around phones and iPhones and things like that where they have to
Mhm.
log in things. Why not just set it up so that door rings to your phone and you're at bedside and you see that Mrs. Jones in room 3 has a visitor, and that's her daughter?
Mhm.
Okay, I'm going to open the door right from there.
And I want to flip that around. The like you said, automation would help. That gets old quickly. They start to circumvent the process, like you said. So automation would help, but there has to be something that's blocking that even because I was on a IHSS children's hospital call this morning. We had a focus group. TJ Bach leads it and some of the other people that are on there. So there's hospitals, specifically when it comes to children, there's hospitals that are locking units and they're giving mom and dad a badge to get up there and that's how you get in. They were talking about that on a call this morning. What keeps that from being more widespread? That automation that you just spoke about, like, or the automation needed that you just spoke about, why isn't there more of that? To lock that unit, only let Cleat up once I verify Cleat is who he says he is. Why isn't there more of that?
Well, a couple of reasons why. First, children's hospitals have a whole different risk profile than hospitals that deal mainly with adult patient populations.
Mhm.
Adults can defend themselves in most cases, and but children are susceptible, and they're also, the hospital kind of takes on this in loco parenti, means we take we stand in the shoes of the parents in a lot of cases in terms of our liability.
Mhm.
When those children are in our hospital, we have to protect them, and that's the difference there. Now, knowing that, and if you have a children's hospital, you'll have a culture where everybody understands that type of safety precaution, and the need for that. when you have an adult patient population, and again, it all comes down to resources. So the folks
Mhm.
at the information desk, maybe they're just volunteers.
Yes,
Maybe
we talked about
they're
that this morning.
old like me and are technologically challenged, you know. Uh,
And
so automation won't work in those types of environments. So that's what it is. Sometimes it's
yeah.
either funding, resourcing, the organizational will to provide security at that level.
Mhm.
There's a lot of different factors that contribute to that.
To me, that makes, coming to a broader conversation, that continues to make the argument even more so for automation is the lack of, and bringing that back. I was dealing with a healthcare organization a couple years ago where they organizationally, they wanted the software, they had the budget for the software, it was the people. They didn't have the people to do visitor management the way they needed to, so they could never pull the trigger on it. But that was on visitor management, and you do need some warm bodies in the seat for visitor management. I understand that, but that still ties into what you said before. There's only X amount of resources. I think one of your examples you gave, there was two people handling everything, and that just again just speaks to the more automation, the better. The more we can do in the background, the better. Um, Let me go to lost badges for a minute before we wrap up. Lost badges, because again, that plays into reducing access risk, which we're talking about here. I personally know of examples where things happen because of lost badges. Famous parking lot incident that always comes to mind, and it was all based on a lost badge, and that's how the person gained access to go and get to someone he legally had no business seeing, et cetera, et cetera. Do you get a chance to see automation when it comes to lost badges? I personally have never. I have never talked to a hospital that had automation as part of their lost badge process. If Cleet loses his badge, he has to email someone, call someone, go down, fill out a form. I have not encountered a hospital that had automation yet. Would love to hear what you think.
Yeah, unfortunately, I'll validate what you're saying.
Yeah.
I can't think of any hospital that I've actually surveyed that had a an automated process for a lost badge, and I like the potential for that in the
Mhm,
future. Because we're all concerned about lost badges,
mhm,
especially when it's maybe a physician or an executive or a security director would have almost carte blanche access
mhm.
throughout the facility. That is that's like the grand master key
It
to your
is. It
hospital,
is.
and it gets lost.
Yeah.
Um, so here's a story. I had a hospital one time, and physicians were kind of given everything that they needed, and that included as many ID badges as they wanted. And so I remember this one guy had like 6 cars, and he wanted an ID badge for every one of his cars because he just didn't want the hassle of having to keep track of that one badge. So he just wanted it in his car so he can get into the physician's lot
Mhm.
and get into the building, the doctor's lounge. Yeah, I mean, you have to engineer your processes here or more around, access control.
Mhm.
When I gave them the Grandmaster key speech, like I just gave you, it's like the light went off, like, oh my God, that's right. And I don't know how many times you're walking through like a Target parking lot or going grocery store and you see people with their rear view and then they got their ID badge hanging right
Hang on
there.
right there. Yeah.
You know,
Yep.
here I'm Bill Marcis, at such and such hospital. Yeah.
Yep. Yep. There's a figure
Uh,
I've seen that talks about one of the biggest forms of ransomware has to do with lost credentials. So, like to your point, the importance of it, like no automation is there, but imagine if we're at a point where you could have automation, like, and we've been there for years. There should be automation when it comes to that in healthcare, in immediate deactivation. At least start there. Let's not speak about how you can start the renewal process immediately, but quickly deactivate that badge. That's there. It's been there for years. And thank you for sharing. Now, I'm not sure why it's not more of it. You said you haven't bumped into it. I never hear about it, but I mean, obviously, you're going to talk to a whole lot more healthcare people than I did. But that seems like low hanging fruit to me, and seems like a huge risk because the flip side is they lose badges every day. They're replacing badges every day. Some to the tune, there's 40,000 identity hospitals. So some people are doing 100 lost badges a day, manually doing them. So not only is it a huge manual time suck in the process, it's a huge risk because that's 100 active badges per day and whatever you don't get to. So I'm not quite sure why there isn't more automation in that respect. Maybe that's something that you can preach about as you go forward and preach.
I think it's a valid point. You know, I think that the landscape is going to change in terms of liability too in the next couple of
Oh,
years with automation. So the examples that I was giving you about you know, people finding a badge and then using it nefariously to gain access and do
mm,
whatever could be something that could be addressed. And I just had a case where access control became a central point of issue, and
oh
it,
yeah.
it, yeah, and it was a pretty significant matter where one employee who was not supposed to have access
Hmm.
while they were dealing with an employment issue, and then came into the building using their ID to um, actually kill and assassinate another coworker.
Mm,
So
mm.
um, plaintiff's theory of liability was that your process should have caught this when that person went out. The reality of the situation was that this is not an industry standard right now.
Mm.
And we defended the case on that point, among others. But
So you're
uh,
saying like you see you could foresee that the industry will have to shift based on things like that coming forward, where it was kind of like the expectation that you were doing something about this.
right, I thought the plaintiff's attorney was very perceptive to pick up on that. Um, and he tried to make a case out of it. However, when we look at the industry standards and guidelines and things that are out there right now, and even the practicality of automation when this event occurred, maybe 5 years ago, the technology just wasn't there,
Mhm.
and it would have been highly burdensome for any organization to adopt what this attorney was trying to put forth. However, the tide is shifting here,
Mhm.
and if automation becomes easy to deploy, affordable, and such that most hospitals and maybe other businesses in the country start utilizing an
Mhm.
automation badge process system like this, I could see maybe in 5, 10 years that becomes the new industry standard, and that this incident happening, 15 years from now would clearly be negligence, for not having that type of process, Uh,
Very interesting. And I know hindsight is 2020. To hear you say it was a burdensome process, um, what they put forward, it was a burdensome process. Knowing what you know now, could that tragedy have been avoided with automation?
I would say probably not, because
Okay.
in this situation, the interpersonal relationship here was such that the aggressor would have probably sought the victim somewhere else.
Somehow,
Now
some way. I got you.
it would have been prevented from that facility maybe,
Yeah.
but maybe outside the facility, maybe not,
Yeah. Yeah. Great point. That it may have changed time, date, et cetera. But, when you think of the widespread reach, and how, I can imagine how many people were impacted in a care facility by something tragic happening like that on their grounds.
Yeah, well,
And thank you for sharing that, Bill.
the risk is different though. The
Yes.
risk, somebody with a firearm shooting in your building,
Yes.
um, that's a pretty significant risk, and other people could have been injured. That fortunately they were not, but wha- you know, getting that incident to occur somewhere else, hopefully not
Yes.
on your property, would
Yes.
would save you a lot of time, grief, aggravation, and damages in terms of what you'd have to pay out in a lawsuit judgment.
Yeah, and like you said, the expectation of protection, that
Yeah.
people are assuming it's there and it's really not. Thank you for sharing that, Bill. Thank you for sharing all these stories, actually, and your insight. I know some of that is what you've seen, some of that is your opinion, some of that is what you would like to see. Thank you very much, Bill. Thank you very much, and then enjoy the rest of your week.
Thank you.